Main objectives of today's lecture are: at the end, you should be able to describe the blood supply, venous drainage, and nerve supply of foot. Now, the blood supply to the foot is mainly by the branches of anterior and posterior tibial arteries. This is the anterior tibial artery. So the branch of the anterior tibial artery is the Dorsalis pedis artery. This is Dorsalis pedis artery. And the second is posterior tibial artery. The branch of the posterior tibial artery which supply the foot are the plantar arteries, that is medial and lateral plantar arteries. So the blood supply is mainly through the branches of anterior and posterior tibial arteries, that is Dorsalis pedis artery. This is Dorsalis pedis artery. It is the branch of anterior tibial artery, and this artery supplies the dorsal aspect of the foot. The second is plantar arteries, which are the branches of posterior tibial arteries, and these plantar arteries supply the sole of the foot or the plantar aspect of the foot. This is another picture that is showing this Dorsalis pedis artery that supplies the dorsum of the foot, and it is the continuation of anterior tibial artery. These are the plantar arteries, that is lateral and medial plantar artery, which supply the sole of the foot, and these are the branches of posterior tibial artery. So the first artery of the foot is the Dorsalis pedis artery. This Dorsalis pedis artery, this is the Dorsalis pedis artery. The Dorsalis pedis artery is the continuation of the anterior tibial artery. After passing through this extensor retinaculum, this is the extensor retinaculum. After passing through this extensor retinaculum, the Dorsalis pedis artery runs anteromedially on the dorsal aspect of the foot. And when this Dorsalis pedis artery reaches at first introitious space, it divides into two branches. The one is first dorsal metatarsal artery, and the second is deep plantar artery. So this is the Dorsalis pedis artery. At this level, it divides into this first dorsal metatarsal artery and this second deep plantar artery. Now look at the picture. This deep plantar artery passes inferiorly deep to the first dorsal interosseous muscle to enter into the sole of the foot. Now look at this picture. This is deep plantar artery. Passes inferiorly between metatarsal 1 and 2 to enter the sole of the foot by passing deep to the head of first dorsal interosseous muscle. Now this deep plantar artery is basically the terminal branch of the Dorsalis pedis artery, and this terminal branch enters into the sole of the foot by passing deep to which muscle? First dorsal interosseous muscle. Now in the sole of foot, this is the deep plantar artery, which is the terminal branch of Dorsalis pedis artery. Now this terminal branch enters into the sole of the foot. Now in the sole of the foot, this deep plantar artery joins the lateral plantar artery to form the deep plantar arch. The pulsations of Dorsalis pedis artery. This is Dorsalis pedis artery. The pulsations of Dorsalis pedis artery are felt on the dorsal aspect of the foot by gently palpating the vessel against the underlying tarsal bones between the tendon of extensor hallucis longus and the tendon of extensor digitorum longus. This is the tendon of extensor digitorum longus towards the great toe, and this is the tendon of extensor digitorum longus of the second toe. This is extensor hallucis longus, and this is the tendon of extensor digitorum longus. Now during its course, the dorsalis pedis artery give rise to several branches. This is the dorsalis pedis artery. Itself is the continuation of anterior tibial artery. Now this dorsalis pedis artery during its course give rise to several branches. The first branches are the tarsal arteries. This is the dorsal pedis artery, give rise to medial tarsal and the lateral tarsal artery. This lateral and medial tarsal arteries supply the adjacent structures and aids by anastomosing with the vessels which are present around this region, around this ankle region. Then this dorsalis pedis artery, when reaches at the first introitious space, it gives rise to first dorsal metatarsal artery. This is first dorsal metatarsal artery, and the second we have discussed, deep plantar artery. This is deep plantar artery. So this dorsalis pedis artery gives rise to deep plantar artery, which passes into the sole of the foot, which we have discussed, and it gives rise to first dorsal metatarsal artery. This first dorsal metatarsal artery, this is the first dorsal metatarsal artery. Look at the picture. This first dorsal metatarsal artery supply both the sides of the great toe and the medial side of the second toe. So the great toe as well as the medial side of the second toe are supplied by the first dorsal metatarsal artery. The third important branch of the dorsalis pedis artery is the arcuate artery. This arcuate artery passes laterally on the dorsal aspect of the foot. This hole is the arcuate artery, which passes on the dorsal aspect. Now this arcuate artery supplies the remaining digits. The big toe and the medial side of the great toe are supplied by the first dorsal metatarsal artery. Now the remaining digits are supplied by the arcuate artery. This arcuate artery further give rise to two types of branches. The one are three dorsal metatarsal arteries. This is first, second, third. So this arcuate artery, this hole is the arcuate artery. It gives rise to this first, second and third metatarsal arteries, which supply the adjacent sides of second to fifth toe, because the medial side of the second toe is supplied by dorsal metatarsal artery. So the adjacent sides of second to fourth toe are supplied by the dorsal metatarsal arteries. The arcuate artery from this lateral side give rise to another branch, which is the dorsal digital artery. This is the dorsal digital artery, which supplies the lateral side of the little toe. Okay, so let's revise the dorsalis pedis artery, which is the continuation of the anterior tibial artery. After passing beneath the extensor retinaculum, it passes anteromedially on the dorsal aspect of the foot and aids by dividing into two branches. The first is dorsal metatarsal artery and the second is deep plantar artery. The deep plantar artery, this is deep plantar artery and this is first dorsal metatarsal artery. Deep plantar artery passes into the sole of the foot by passing deep to the first dorsal introitious muscle, where it joins the lateral plantar artery to form the deep plantar arch. So now the branches of the dorsalis pedis. This deep plantar artery is considered as the terminal branch of the dorsalis pedis artery. Now come to the branches of dorsalis pedis artery. The first branch are the medial and lateral tarsal arteries, which supply the adjacent structures. Then the first dorsal metatarsal artery, which supplies both the sides of the great toe and the medial side of the second toe. The third important branch are the arcuate artery, which supplies the adjacent sides of the remaining digits. First, it gives rise to three metatarsal arteries, three dorsal metatarsal arteries. This is first, this is second, and this is third. These three dorsal metatarsal arteries supply the adjacent sides of second to fourth toe. And then this arcuate artery, after giving the three metatarsal arteries, give dorsal digital artery. This is dorsal digital artery, which supplies the lateral side of the little toe. Now come to the second artery of the foot, that is posterior tibial artery. This is the posterior tibial artery. The posterior tibial artery enters the foot through the tarsal tunnel on the medial side of the ankle and posterior to the medial malleolus. It bifurcates into small medial plantar artery and a large lateral plantar artery. Midway between the medial malleolus and the heel, the pulse of the posterior tibial artery is palpable. Now look at the picture. This is medial malleolus and this is heel. In between these two structures, the pulsations are felt. Now this is the posterior tibial artery on the medial side of the ankle behind the medial malleolus and give rise or bifurcates into two branches, that is medial plantar artery and the lateral plantar artery. So the first is lateral plantar artery. This is the lateral plantar artery. This lateral plantar artery first passes deep to the abductor hallucis muscle. This is abductor hallucis muscle, that is the muscle of first layer of sole of foot. So this lateral plantar artery first passes deep to the abductor hallucis muscle, then it passes between the flexor digitorum brevis and the quadratus plantae muscle. This is flexor digitorum brevis and this is quadratus plantae. So first it passes beneath the abductor hallucis muscle and then between the quadratus plantae and the flexor digitorum brevis muscle. When this lateral plantar artery reaches at the base of fifth metatarsal, this lateral plantar artery now curves medially and joins the deep plantar artery to form this plantar arch. Now the branches of the deep plantar arch. The deep plantar arch, this hole is the deep plantar arch. The deep plantar arch give rise to three types of branches. The one is digital branch. This is the digital branch, which supplies the lateral side of the little toe. Then it gives rise to four metatarsal arteries. 1, 2, 3 and 4. Now these four metatarsal arteries supply the adjacent sides of toe 1 to 5, adjacent sides of toe 1 to 5, 1, second, third, fourth, toe, fifth. So it supplies the adjacent sides of first to fifth toe, as well as these metatarsal arteries also supply the medial side of the great toe as well. Then it gives rise to perforating branches, three perforating arteries. It also gives rise to three perforating arteries which anastomose with the other arteries of the foot. Now come to the medial plantar artery. The main artery of the plantar aspect you have to remember is the lateral plantar artery. The medial plantar artery is the small artery of the sole of foot. This is the medial plantar artery. This artery passes into the sole of the foot by passing deep to the abductor hallucis muscle. This is the abductor hallucis muscle, and this hole is the medial plantar artery which passes deep to the abductor hallucis muscle. Now this medial plantar artery gives rise to deep branches and the superficial branch. The deep branch mainly supply the muscles, and these both, the superficial and the deep branches, assist the metatarsal or the digital arteries of the lateral plantar nerve to supply blood to the digits. Okay, so there are two arteries which are supplying the sole of the foot, the medial plantar artery and the lateral plantar artery. The lateral plantar artery is the major artery, and it gives rise to, first it forms the digital arch. This digital arch gives rise to digital branch, metatarsal branches and perforating branches. The second is medial plantar artery, which is small artery, passes deep to the abductor hallucis muscle. It gives rise to deep and superficial branches. These branches of the medial plantar artery assist the branches of lateral plantar artery to supply the digits. Now come to the veins of the foot. The veins of the foot, or overall the veins of the lower limb, are divided into superficial group and the deep group. The deep group of vein is situated beneath the deep fascia, whereas the superficial group is present in the subcutaneous tissue. Now, the deep veins accompany the arteries, and most of the deep veins mainly accompany or follow the arteries. The second group of veins are the superficial veins. Now, unlike the leg and the thigh, the venous blood of the foot mostly drains into the superficial veins. Usually there are two groups of veins, the deep and the superficial, but in case of foot, mostly the venous blood passes into the superficial veins. The superficial veins drain into the dorsal venous arch. This is the dorsal venous arch, which is present on the dorsal surface of the foot over the metatarsals. This is the dorsal venous arch in which the superficial veins of the foot drain. Now this dorsal venous arch further give rise, from this dorsal venous arch two veins arise, or we can say this dorsal venous arch continue upward as great and small Syphilis vein. So on the medial side there is the presence of great Syphilis vein, and on the lateral side small Syphilis vein. Now great Syphilis vein is is the great Sephirous vein, which originates from this dorsal venous arch. It originates from the medial side of the dorsal venous arch and passes, look at the picture, this passes anterior to the medial malleolus, and then in the leg it passes on the medial side of the leg. The second is small Sephirous vein, which originates from the lateral side of the dorsal venous arch. It is present on the lateral side, so it passes in relation with the lateral malleolus, but you have to remember that it passes posterior to the lateral malleolus, and in the leg it runs or it passes on the posterior aspect of the leg. Now the nerves of the foot. The foot is supplied by the tibial nerve, deep fibular, superficial fibular, sural and saphenous nerves. The first is tibial nerve. The tibial nerve mainly supply the sole or the plantar aspect of the foot. This tibial nerve enters the foot. This is the tibial nerve. The tibial nerve enters the foot through the tarsal tunnel posterior to the medial malleolus. This tibial nerve gives rise to the calcaneal branch, which supplies the heel, and in the midway between the medial malleolus and the heel, the tibial nerve gives rise to medial plantar nerve and the lateral plantar nerve. So there are two nerves which supply the plantar aspect of the foot like the arteries, that is medial plantar nerve and the lateral plantar nerve. So the first is medial plantar nerve. This medial plantar nerve has a sensory as well as motor innervation, but this medial plantar nerve is considered as a major sensory nerve. It considered as a major sensory nerve in the sole of the foot. This nerve innervates, this pink colored is the medial plantar nerve. It innervates the skin of the anterior two-third. This is the anterior two-third of the sole of foot. This is posterior one-third of the sole of foot. So this medial plantar nerve supplies most of the anterior two-third of the sole of the foot as well as the adjacent surfaces of plantar aspect of 3.5 digits, because the dorsal aspect of the foot as well as the dorsal aspect of digits are supplied by different nerves. So that's why we are saying that the anterior two-third of most of the anterior two-third of the plantar aspect of foot as well as the medial 3.5 digits, the plantar aspect of the medial 3.5 digits is supplied by medial plantar nerve. It innervates, motor innervation is that it innervates 4 intrinsic muscles of the sole of foot. In the sole of foot, various muscles are present, but you have to remember that only 4 muscles are supplied by the medial plantar nerve. All the remaining muscles of the sole of foot are supplied by lateral plantar nerve. For this reason, the lateral plantar nerve is considered as major motor nerve, whereas the medial plantar nerve is considered as major sensory nerve. Although both these nerves have motor and sensory supply, but the medial plantar nerve is major sensory because most of the skin of the plantar aspect is supplied by medial plantar nerve. And if we will talk about the motor innervation, then only 4 muscles are supplied by the medial plantar nerve. You have to remember the names of these muscles. That is abductor hallucis, flexor digitorum brevis, flexor hallucis brevis, and the first lumbrical. These four intrinsic muscles are supplied by the medial plantar nerve. This medial plantar nerve give rise to two branches. The one is proper plantar digital nerve. This is the medial plantar nerve which give rise proper plantar digital nerve. Look at the picture. This proper plantar digital nerve supplies the medial side of the great toe. Second, this medial plantar nerve give rise to three common plantar nerves. These three common plantar nerves supply the adjacent surfaces of toe 1, 2, 4. The adjacent surfaces of toe 1 to 4 are supplied by the common plantar digital nerves, which are the branches of medial plantar nerve. Simply remember that the medial plantar nerve supplies first, second, third digit and the medial side of the fourth digit. Clear? The medial plantar nerve supplies whole of the first, second, third digit and the medial side of the fourth digit. The remaining digits. Which remaining digits? Lateral side of the fourth digit and whole of the fifth digits. These sides of the fourth and fifth digits are supplied by lateral plantar nerve. Clear? Now the medial plantar nerve, we are saying that the medial plantar nerve supplies first or the great toe, second toe, third toe and the medial side of the fourth toe by two branches. The one is proper plantar digital nerve which supplies only to the medial side of the great toe and by three common plantar digital nerves which supplies the adjacent sides of digit 1 to 4. Now come to the lateral plantar nerve, which is considered as the major motor nerve in the foot because all of the intrinsic muscles of the foot are supplied by the lateral plantar nerve except the four muscles which we have discussed which are supplied by medial plantar nerve. So the lateral plantar nerve is major motor because it supplies the majority of the muscles of the sole of foot. So the motor innervation to the muscles of the sole of foot and sensory innervation. Now this lateral plantar nerve innervate the skin on the lateral side of anterior two-third. This is anterior two-third. So the lateral side of the anterior two-third and the plantar aspect of lateral 1.5 digit is supplied by lateral plantar nerve. Most of the plantar aspect and the plantar aspect of medial 3.5 digit is supplied by medial plantar. Lateral aspect of anterior two-third and lateral 1.5 digits are supplied by lateral plantar nerve. Now this lateral plantar nerve divides into superficial and deep branches near the head of fifth metatarsal. Now this is lateral plantar nerve. This lateral plantar nerve divides into this deep branch and this superficial branch near the head of fifth metatarsal. The deep branch is mainly motor, whereas the superficial branch now supply the remaining digits. Which remaining digits? Lateral side of the fourth toe and the whole of the fifth toe. Now this lateral plantar nerve again supplies these remaining toes by giving two branches. Again the one is proper plantar digital nerve which supplies the lateral side of the little toe. This is proper plantar digital nerve. This one, it is proper plantar digital nerve, which supplies lateral side of the fifth digit, and then it gives rise this one. This is common plantar digital nerve, which supplies the adjacent side of the fourth and fifth toe. Okay, so the sole of foot is supplied by two nerves, the medial plantar nerve and the lateral plantar nerve. The medial plantar nerve is the major sensory and the lateral plantar nerve is the major motor. This medial plantar nerve supply the great toe or the first, second, third and the medial side of the fourth toe by two branches. The one is, this is proper plantar digital, which supply the medial side of the great toe, and these three common plantar digital, which supply the adjacent sides of first to fourth toe. The second is lateral plantar nerve, which at the head of fifth metatarsal divides into deep and superficial branches. The deep branch is motor, whereas the superficial branch supplies the remaining digits by giving rise two branches. The one is this proper plantar digital, which supply the lateral side of the toe, and these are the common plantar digitals. Where are these common plantar digitals? These are the common plantar digitals, which supply the adjacent sides of fourth and fifth toe. The common plantar digital nerves, which are supplying the adjacent side in both the lateral and medial plantar nerve, further named as proper plantar digital nerve, but mainly they are common plantar digital nerves. Then there is the presence. Then the third nerve is deep fibular nerve, which supplies the dorsal aspect of the foot. Plantar aspect is supplied by medial and lateral plantar nerve. Now come to the dorsal aspect of the foot. Now we will discuss the nerves which are present on the dorsal aspect of the foot. The first nerve of the dorsal aspect is the deep fibular nerve. It innervates the extensor digitorum brevis muscle. Mainly it innervates the extensor digitorum brevis muscle with small contribution to the first two dorsal introsci. This deep fibular nerve, this is the deep fibular nerve, yellow color. This deep fibular nerve supplies sensory branches to the skin on the dorsal side of first and second toe. The first web space which is present between these first and second toe. Only this small part is supplied by deep fibular nerve. So what is written? It supplies general sensory branches to the adjacent dorsal side of first and second toe and to the web space which is present between the first and second toe. The second is superficial fibular nerve. This yellow colored is the superficial fibular nerve. This whole yellow colored is superficial fibular nerve. This superficial fibular nerve is sensory to most of the skin. Most of the skin of the dorsal aspect is supplied by the superficial fibular nerve. So most of the dorsal aspect of the foot as well as most of the dorsal aspect of the digits is supplied by superficial fibular nerve. Then there is sural nerve. This is the sural nerve, which is this light blue colored is the sural nerve, which is the cutaneous branch of the tibial nerve. The sural nerve innervates the skin on the lateral side of the dorsum of the foot, as well as it innervates the dorsolateral aspect of the little toe. The little toe the medial side of the little toe is supplied by superficial fibular nerve. Now this little toe has two supplies. The medial side, look at the picture, the medial side is supplied by superficial fibular, whereas the lateral side of the little toe is supplied by the sural nerve. Then the last is Sephirous nerve. This green colored is the Sephirous nerve, which is the cutaneous branch of the femoral nerve. Now this Sephirous nerve innervates the skin on the medial side of the proximal foot. This hole is the medial side of the foot. But the proximal part of the, only the proximal part of the medial side is supplied by the Sephirous nerve, because the lower part of the medial side again is supplied by the superficial fibular nerve. So Sephirous nerve innervates skin on the medial side of the proximal part of the foot. This whole is the medial side, but only the proximal part of the medial side is supplied by the Sephirous nerve. So this all is about the vessels and nerves of the foot.